A lot of people experience lower back pain and pain, in your backside and your behind, and it sometimes goes out into your leg and have no idea how to remedy that pain. Dr. Sonia Spencer with Spencer Chiropractic does know how to fix that. Tell us what we're talking about.
Oh, I do, and I love to treat patients who have this problem because it's really debilitating, to what we have going on in life. When you have this, it's severe pain that's really affecting your life, affecting your ability to work, maybe get off and on the toilet, maybe get in and out of bed, maybe you're sleeping.
The important things in life.
Yeah, and there's so many things going on. That's why a good history is very important. A lot of my patients tell me, Dr. Spencer, you're a very good listener. And I do want to get to get to the root of the matter. The Buddhists say work at the root, and I like to work at the root, because if we're just clipping branches up here, we never really find out what's causing it. And I think about medications, just treating the symptoms rather than getting to the root cause of the problem. And that's why so many people get on a medication, they stay on a medication, or once they start the shots in their back, they stay on the shots. And sometimes a lot of times their problems can be managed, eliminated, or taken care of with chiropractic care. So let's talk about some of the things that can cause it. Of course, when you have pain in the lower back, it can affect these nerves. The nerves come out of the lower back and can go down the leg. Now, the lower back nerves and what's called the sacral nerves form the largest nerve in the body, which is the sciatic nerve. So people with sciatic nerve pain could just have pain right here in the butt, or they can have that pain that goes all the way down to the legs and even into their toes. It's usually pretty excruciating pain if the problem is super severe. So what are we going to do when you come in? Well, first I'm going to talk to you. I'm going to find out how long it's been going on. Have you had multiple episodes? Is this your first episode? Is this your second? Or has this been a lifelong problem for you? What all you've done to treat it. I'm going to do a few tests on you, probably take some recent x-rays, get your MRIs. If you've had any nerve conduction tests, I'm going to look at those so we can develop a treatment plan to not only get you out of pain, but work at that root that we talked about, that's causing the problem and keeping you from having the quality of life that you want to have.
There's so much of, in just medicine in general, there's so much of treating the symptom. Mm-hmm. And I think that a key part of eliminating the problem to begin with is, like you said, find out what's causing that and attack that first.
Exactly right. So yesterday I had a patient come in and he told me, he said, I've got so many disc problems in my back that I went to a chiropractor and he said, I'm not going to touch you. Well, I got the MRI in yesterday and the disc problems are really minimal, and the treatment is not going to be as catastrophic as what the patient was really scared.
Sure.
Scared to get chiropractic care. So one thing I'm going to do is I'm going to get all the test results that you've already had, and I'm going to look at that and I'm going to see how we can help you, maybe with chiropractic, maybe with decompression, maybe with laser therapy, because a lot of my patients have had back surgeries and fusions. Really the only thing I can do on them is work on their hips a bit and do some laser therapy. Now when we put laser on this nerve here, for many people who've already had surgery, and they can't be adjusted and they're still in pain, the laser is a solution for them to help get them that relief that they were looking for that the surgery did not provide them. But if you haven't had surgery, you're going to be in much better shape to get the relief from the stuff we're doing in the office. The decompression, either the chiropractic adjustments, the class 4 laser, and we have some other stuff here as well. But it's just determining what's right. It's not cookie cutter for every single patient. And we do have a good success rate here. Not every patient gets better, but the things we do here are non-invasive. They don't, no shots, no drugs, no surgery, no ongoing medication, and everything is natural.
I haven't been involved in chiropractic care for a long time, only just probably the last year, maybe year and a half. But from what I'm learning is that chiropractic care today is not the same care as it was 10, 15, 20 years ago. There are so many other options within this office that are not just an adjustment. You've mentioned a few already, and that is really what it takes to give you a full spectrum healing process, I guess.
Exactly right. And you know, I've been a chiropractor over 20 years. And when I first started, we didn't have non-surgical decompression. We didn't have the class 4 laser. And so things have evolved. And when I got limited results with chiropractic, I started searching what other options would be available for this patient that we could do within the scope of our practice that would keep them from having another surgery, get them off the dangerous medications that are making them sleepy and making them fall and, you know, causing a lot of side effects. I've had patient spouses bring them in and talk to me about the medication because they're scared because their spouse is losing memory from some of the nerve medications and losing their balance. And it can get kind of scary for people who, you know, are stuck in pain and they're stuck on medications, you know, that they really don't want to be taking.
What about children? Or is this something that if children are having the same issues, for example, say maybe there was a car accident, or there was some kind of traumatic experience like that, physical traumatic experience, is there some way that, are you helping children as well in these situations?
Absolutely. Well, I don't really treat a lot of children in my office. I do have more of a senior population. Mm-hmm. I do have a friend, Dr. Candy, who treats more kids than I do, and that's her specialty, but mine is not. Mine is more focused on adults and senior adults.
And these are very common things with adults and senior adults that you're seeing almost on a daily basis.
Yeah, our senior population, you know, has a high prevalence of back pain because of disc degeneration. You know, this is normal, healthy disc. As we go down the road, the disc can get very thin and people can develop spinal stenosis. Well, by the time you get to the end of that, you know, there's not as much reward from getting treatments as there is in the beginning. So if I got a patient in, like that patient who thought he was in bad shape, but he's really only here, you know, it's a different outcome than a patient that comes in, they're almost totally fused, have no disc, and their spine is literally growing into their spinal cord and spinal nerves. And so many people try to fix this problem with surgery, but they've lost mobility and they're too old for the surgery and they never come back from it. And that's what I see a lot of.
Absolutely. I think you hit on it there. Make sure that you're recognizing the feeling in your body. Mm-hmm. When something feels off, when you lose range of motion, that's what I noticed with my neck injuries. I couldn't turn all the way. I could turn further one way than the other. That was the first sign for me to get him and see a specialist and find out what exactly is going on, because you don't want to be phase 3.
No.
You don't want to, because it's hard to come back from that, if not impossible.
Exactly.
All right, well, Dr. Sonia Spencer over at Spencer Chiropractic. Listen, if you're feeling a little off, this is the time to give Dr. Spencer a call. Come check her out. She's at Spencer Chiropractic on Pass Road in Gulfport.